Knee pain is incredibly frustrating and makes day-to-day life really hard. Sometimes knee pain is because of a structural issue, but very often it has a lot to do with your muscles. And even with things like arthritis, massage has been shown to be really helpful for knee pain. So in today's video, in the series, How We Help, I'm going to talk about how we help if you have knee pain. Hi, I'm Catherine. I'm the founder and principal therapist at LSM Clinic. And in this channel, I share information about how the body works and how you can enjoy your favorite activities pain-free or as close to it as possible. Now, knee pain is really, really common. And it's especially common with runners and cyclists and people who have demanding jobs where they're on their feet a lot or they're going up and down stairs. So we have a lot of people who work in healthcare, like nurses and other people who work in hospitals that get knee pain. The thing that you want to understand about the knee is that it is the most stable joint from the waist down, in that it's a hinge joint. And so it can really only go like this. What that means is the knee often ends up taking a battering because of instability in the pelvis and the hips and instability in the ankle. Now, as I mentioned in the intro, sometimes knee pain can be caused by structural issues. So it's always a good idea if you have a chronic knee problem and there's a lot of pain to go to your doctor and get checked out. And they can exclude things like ACL damage or other ligament damage or meniscal tears, which is the cartilage between the knees. That said, there is some good evidence to show that massage, when there is things like osteoarthritis in the knee, can actually really help management of knee pain. And I'll include the link to an article about that below for your reference. So how do we help the knee? So the first thing we do, as always, is we look at your knee, we look at your leg, we look at your hips. Sometimes the whole leg is externally rotated, and that's coming from the hip, and that's usually the external rotators that are doing that. Sometimes the foot is turned out, but the kneecap is straight, and that will indicate that the muscles in your lower leg are tight and kind of creating a little bit of rotation, which can create an issue in the tracking. Most knee pain that we see is caused by IT band tension, quad tension, which are the muscles at the front of the thigh, and hamstring tension. However, usually those muscles are tight because they're compensating for something else. The quads are the muscles in the front of the thigh, and they're also on the sides of the thigh, and they all come across the knee. So if you have pain right under your kneecap in the front of your knee or behind the kneecap, or there feels like a bit of a compression feeling in the knee, very often it's the quads and sometimes the IT band that needs to be released for that. If you have pain on the inside of the knee, it might be the IT band or it could be the hamstrings that attach there. Now, the most common reason that people have knee pain and have this tension building up in the muscles that cross over the knee is, if you've watched this channel before, you've probably guessed it already, glute activation. That's right. If your glutes aren't activating, it affects the way that the hip stabilizes the thigh. And so if the thigh isn't being stabilized properly, the knee will kind of move around a little bit more, and then the muscles around it will contract. Now, how did we come up with this? So this was very much based on clinical observation. So initially, I started noticing that people would have different curves on the side of their legs. And if you Google it, you'll see there's something called a Q angle, and that kind of indicates whether you're more likely to have knee pain. But the interesting thing was that when we start releasing the IT band and the quads, especially the quad on the outside of the leg, we can actually change that curve in your leg. So most of the time when we work with clients, they'll have like their knee will come in like this or their lower leg will come out. And when we work on the outside line, sometimes in the lower leg, well, usually in the lower leg as well, we start to see that the knee shifts over and it's more of a straight line through. So there's less of that pressure pushing the knee in. And so when we started to release that outside line, we would notice that the tracking of the knee would get better and the alignment would look better. But of course, if you don't address the underlying reason why that's happened in the first place, it's going to come back. So then we started looking at glute activation, because glute activation is basically responsible for almost everything. Glute, lower abdominal, pelvic floor, right? We really want to be stable in our hips. So we started getting clients to do glute activation work. And this is different than glute work. And I actually have another video about why your glute work might not be working if you are doing lunges and squats and you're still having problems associated with not strong glutes. I explain why that might be in this other video, which I'll link below. But we make sure that the clients are actually using their glutes, and that the glute work that they're doing, they're actually having the right form and they can feel their glutes kicking in. And then as soon as the glutes kick in and consistently kick in when they're running or cycling or going about their day, then the legs don't get as tight. And we see that when people actually stick with their glute activation, people come in, even they're running, 20 kilometers a week, preparing for a marathon, their IT bands and quads are not as tight as they were when they first started to see us, like on an extended period of time. So we assess, we identify what muscles are tight, which are usually the muscles that I've described in this video. We release those muscles, and then we work with you on how you can incorporate easy glute activation work to support your legs. Sometimes we will also work with you on waking up the small muscles in your feet, as they can be having something to do with the ankle, but we always want to do the glutes first, as they can help a lot with ankle instability. So if you have knee pain and you would like to come see us and try our approach to helping with knee pain, we would love to see you at the clinic. We can also do video sessions. You can book online, and I'll put the link below, but it's lsmclinic.co.uk/booking. And if you are watching this before January, mid-January, we are doing a glute activation challenge. It's 5 minutes for 5 days, just like we did for our desk worker challenge in November. But this is centered all around getting your glutes activating and being able to tell if your glutes are actually working. Whether you are a runner, a cyclist, have knee pain, or maybe you just do weights and train at the gym, this is for you. So if you'd like to sign up for this free challenge, the link is below. If you know anyone who has knee pain and you think might be interested in watching how we help knee pain, please feel free to share this video with them. Please like it and subscribe to our channel so you'll be notified as we release new videos. And I look forward to seeing you in the next video. Okay, bye.